My name is Heinrich Geldschläger. I'm originally German psychologist and psychotherapist working in Barcelona, Spain, at a small NGO called Connexus. And I will tell you a little bit more about what we do at Connexus briefly in a second. And I'm very honored and happy to have this opportunity to share some ideas, materials, and experiences with you, and hopefully have an interesting exchange. I want to thank Osvaldo and the whole Ubuntu organizing team for doing such a fantastic work with all these different sessions over so many months. I vividly remember still the second Men Engaged Symposium in Delhi more than 6 years ago, which was actually one of the most amazing experiences in my professional life, to meet with over 1,000 people from so many different countries and contexts to create this community of belonging and shared purpose in our work for gender equity and social justice. So I'm really honored and pleased to be able to have this workshop with you. And I think since we're a rather small group, it would be nice for everybody to briefly present themselves and say their names and where they are connecting from, what time of day and what season it is where you are, and also what your work is about, if you want to share that, and what your interest is in this session on engaging frontline professionals to address gender-based violence in male service users, in the men they work with. So if that's okay, it would be nice to hear from all of you who you are, where you're connecting from.
Yeah, this is Dawood Alam, and I'm connecting from India, New Delhi, and I work for an NGO called Engender Health. Thank you.
What time is it where you are in India?
It's 6:40 now here in India in the evening.
In the evening. So good evening and welcome.
Good evening. Thank you so much. Thank you.
Hello, my name is Sarah Wyszewski. I'm calling in from Oxford in the UK. I did a master's last year in development and emergency practice, and my dissertation was on the role of men in basically empowering women. And I did a case study of Rwanda. So I went and worked with the men, the people, the lovely people at Ramrek in Kigali. So yes, that's me.
Great, thank you. What time do you have? One
lunchtime, which is why there's people around me all carrying plates of food.
Okay, thank you, Sarah.
Hi, can I introduce myself?
Sure, please.
Yeah, hi everyone. My name is Akshat and I'm from Mumbai in India, and same time zone as Dawood, and also it's winter here, like in this region, but in Mumbai it hardly feels winter. I run this organization called the Gender Lab, and we work with adolescent girls in schools, but of late, over the last 4 years, we have also started to engage boys in the conversation. So, and that's what brings me here, because I've been following Men Engage's work for a while now. Met Lakshman last year as well, and I think this session's topic is very important for me because it's been a challenge anyway to figure out how to engage frontline workers. I mean, because our people go out on the field and there's a lot of backlash, etc. So, so I'm just curious to know, and this is my first session since Ubuntu started, so just looking forward to it.
Thank you, Akshay. Welcome. Who else do we have? Loida, Sivam. Please forgive if I mispronounce your names.
Hello, hi.
Hello.
Good morning. Actually, we have 8:11 right now in the morning. And my name is Sivam. Velayam, and I'm from Toronto, Canada. And I am the founder and president of Voice of Men 360. We recently started this organization last year, and we are actually working with the International Men's Day, and currently we are running 4 different live shows, weekly. And we are working on a couple of things, and that's about it. Thank you.
Great, thank you, Sivan. Loida, would you like to introduce yourself? And we have somebody else connecting right now. Te puedes presentar brevemente en castellano si quieres. We have a Loida's saying over the chat that she's from Bolivia and doesn't speak English. I can translate for you if you want. Well, we have Loida from Bolivia. Oh, she doesn't have a microphone. Well, welcome, Loida. Please use the chat. Puedes utilizar el chat en castellano también. Yo lo entiendo, Osvaldo lo entiende. Podemos traducir. We can translate from Spanish. Okay. We have Onette. If you want to briefly present yourself, that would be fantastic. And if not, I will start sharing my presentation. So this is the workshop on engaging frontline professionals to address gender-based violence with male service users, which is mainly based on the Engage project, which I will now briefly present to you all in a second. Just some information on the housekeeping for the Zoom workshop. Please be all patient. If possible, keep your camera on. I think, as Osvaldo said, it is always nice to have this more human communication, even if it is virtual and far distance. Please, on the other hand, keep your microphone muted whenever you're not speaking. But especially since we are a small group, don't hesitate to raise your hand or just unmute your mic, activate your mic, and ask any questions at any time. Please feel free to interrupt me in the moment a question arises. We will hopefully have the chance to use breakout rooms for small group discussions and exercises. And I suggest we make a small break about halfway through the workshop, because 3 hours might be quite a long time to keep the attention up. But if you feel you need a break earlier, please don't hesitate to let me know through the chat or directly. So my proposal for this workshop is, after the presentations, to tell you a little bit about the Engage project, what the idea, its aims were, and the needs analysis we conducted to create the main products of this project, which are the Engage roadmap that I think you were able, through the Ubuntu app, to access, and if not, I'll send you the link also over the chat, and the Engage training package, part of which you will experience during the second part of this workshop as like a sample, a teaser. So we'll do part of the Engage training that we developed during the project. And I'll tell you a little bit about the pilot implementation and evaluation of these results, the roadmap and the training that we did in 2019 in France, in Italy, and in Spain. And I hope we'll have time, lots of time for questions and discussions you might have, not only at the end of the session, but as I said, at any time in between. So we've done this, the short round of presentations. So I will explain you a little bit about my work context. The Nexus Association, as I said, is a small NGO. We're 10 people working here in Barcelona and Spain. mainly in three big areas of work. One is the delivery of services, mainly specialized intervention programs around gender-based violence. So we have an integrated program, including a program for perpetrators of domestic violence, but also for children who've suffered, experienced gender-based or domestic violence in their homes, and we usually work with them together with their moms. We also have a children to parents, a program for children to parents violence, a program where we work with young people, adolescents, and people at universities around gender-based violence with prevention and attention of service delivery for both young victims and young perpetrators, and also a small program for LGBTQI persons in situations of violence. The second big area of the work we do at Connexus is training delivery, training for professionals, workshops like this one, but also awareness raising and prevention workshops at school and in other contexts. And finally, the third context, or the third area, is the one of research, mainly around gender-based violence or gender issues in health. So we've been involved in different, mainly European projects, one on the evaluation of perpetrator programs. I will tell you more about the Engage projects. We're currently participating in a project on gender sensitization and gender prevention of gender-based violence with male refugees and migrants here in Europe, together with colleagues from Italy, Greece, Austria, Germany, and Croatia. Also, we're participating in another program for training future teachers to address gender-based violence at schools with their students, and we will be soon starting another project on child safeguarding and protection in women's shelters in Europe. So these are the different kinds of things that we do at Connexus. I'm also on the board for the European Network for the work with perpetrators of domestic violence, which is an umbrella organizations with currently a bit more than 60 organizations who directly or indirectly work with men who use violence against their intimate partners, but also who work with these partners. So we have more than 60 members from 32 European countries, where the objective, the mission is to improve the quality of perpetrator programs, to live up to quality standards, and contribute really to the safety of women and children, victims and survivors of domestic and gender-based violence, and to help create good and close collaborations with the victim support services. We do different kinds of activities. If you're interested, this is the website with lots of resources, also some recent resources on the work with men under the COVID-19 restrictions and context. All right, so far for instructions and introductions and presentations. As a framework for the Engage project and the addressing gender-based violence with men in first-line services, frontline services, it is important to know the Istanbul Convention, which is the legal framework that we have in Europe around gender-based and domestic violence. and its Article 16 frames the work that we do with men who use violence, and it says in its first part that parties, which are the states, European member states, shall take measures to set up or support programs for perpetrators of domestic violence to change their behavior, and which is probably even more important, that in taking these measures, the parties shall ensure that the safety of, support for, and the human rights of the victims has to be the primary concern in these perpetrator programs, and that they should be established in close coordination with specialist support services for victims. And this is important because it also frames the work that we do in addressing domestic violence with men even before they arrive to a perpetrator program. So the rights and the safety and the well-being of the victims, children and women and children has to be our primary objective and goal at every stage of the intervention that we do with men who use violence.
There is a question from Shiva.
Yeah,
Will be able
please go ahead. I can thank you as well for. Go ahead, please.
Well, Shivan wrote in the chat that if you will be able to send this presentation later on.
Yes, of course. I'd be happy to. Yeah, actually, most of it, I'll say that later. Most of it is available on the project website, on the Engage website. I'll show you the link later on, but I'm also happy to share this PowerPoint in particular. So why is it important to work with perpetrators of domestic violence, while of course also delivering services for victims and survivors? That's of course the first and most important issue, but it is also important to address the perpetrators, since they are the root cause of the problem, but also from the women's point of view, a change in the perpetrator's behavior is seen as very important, as fundamental. And the biggest survey that we know of in Europe has been done a few years ago by the Fundamental Rights Agency of the European Union, and more than 40,000 women in the different member states were interviewed around different aspects of gender-based violence. And what you can see here are the answers of the question, what helped them to overcome the violence. This question was asked to women who had suffered violence, and they were asked what helped them to overcome the violence. And of course, support from family and friends and their personal strengths and resources and decisiveness, or divorcing, separating from the man were the main issues. But interestingly, as you can see, amends made by the perpetrator, or the perpetrator changing their behavior, was seen by the women as more important, even as receiving professional support, as counseling or specialized victim support. So also from the survivor's point of view, changing the perpetrator's behaviors, contributing to this change, is a very important aspect in the efforts to end gender-based violence. So these are some of the ideas that were behind the Engage project. Another one was the results from a survey that we had done in a previous project, the Impact project, on more than 130 perpetrator programs from 22 different European countries, and where we found that many of them, more than half of the programs, do work with men who are not court-ordered to participate in the program, do work with men who are referred by other services or are attending voluntarily without an obligation from the courts. So there's clearly a need for referrals to these programs from frontline services like health services, social services, or child protection services. And also different studies, amongst others, by Marianne Hester's team at the University of Bristol, have shown that many of the men who enter a perpetrator program in the months before entering it attend health or other services, and there is an opportunity to detect, identify the violence they use, and address it to possibly refer them to the programs. But on the other hand, I don't know if you're in your country's situation is different, but most of the guidelines on addressing gender-based violence only refer to, or mainly refer to, the victims, to addressing gender-based violence with women, sometimes with children and youth, but very, very rarely with men. And many frontline workers don't really know how to do this, how to ask men about the possible use of violence. And some are afraid of the men's reactions and the consequences this was had. So there was a clear need for guidance or for training on addressing perpetrators on behalf of the frontline professionals in the different European countries. So the aims the project set out to fulfill was to increase, in line with the Istanbul Convention, to increase the safety of women and children, victims or survivors of violence, by promoting a coordinated response to the perpetrators, to improve the quantity and also the quality of the referrals to specialized perpetrator programs, and also to contribute to a shift in perspectives, mainly for frontline professionals, but also even for policymakers, from making the victims, survivors responsible for their safety, for stopping the violence, to holding the perpetrators accountable, to think of the perpetrators also when thinking of or talking about gender-based violence. The specific objectives that we set out to reach were to build the capacity of frontline professionals to address and to refer perpetrators, and also to improve the coordination between those frontline services, health, social services, child protection, etc., and the perpetrator programs. Please, if there are any questions, don't hesitate. So this is a nice picture of our final conference of the program in the project in Florence. This was a project under the Rights, Equality, Citizenship program of the European Union, by which it was partly funded, and it ran during 2018 and 2019. We at Connexus coordinated it, and we had partners from France, from Italy, and from Germany, and we had we were lucky to have Marianne Hester from the University of Bristol and Neil Blacklock from Respect, which is the umbrella organizations or organization of perpetrator programs in the UK, as our advisory board. So what we mainly did in the project were three steps. We started out with a needs analysis. So we did focus groups and interviews, both with frontline professionals, with men on perpetrator programs, and with experts in the work with perpetrators on their experiences with addressing domestic violence, gender-based violence in male service users, or talking to the men about their experience of being asked about it and how they would like to be asked about it. And also, we did a literature review to see if there were any similar initiatives. And we also based, of course, our whole work on the experience that we, the partners, had in the field. On the basis of this needs analysis and literature review, we developed both the Engage roadmap, which are some guidelines, and the corresponding training package, which basically consists in a PowerPoint presentation that is accessible, and some guidelines for delivering the training. And then we did a pilot implementation of both the roadmap and the training in 3 of the participating countries, in Italy, France, and Spain, and evaluated this pilot implementation, and on the basis of the experience did the final version revision of the guidelines, the roadmap, and the training program. The needs analysis, as I said, included qualitative interviews and focus groups on service needs and the referral pathways, with 18 men on perpetrator programs in Italy and France and Spain. And it was interesting to hear from them how they were sometimes even eager to be asked about the violence, but at least it was okay for them if they were asked with respect and didn't feel judged. That was a very important message on behalf of the men we asked about this issue, the violence being addressed in services. We also did focus groups with almost 100 frontline professionals on their current practice regarding addressing gender-based violence with male service users, on the coordination between services, the possible referral pathways, and of course mainly regarding their needs of training on this issue. And also we interviewed 12 experts in the work with perpetrators on their view of the guidelines that we were to produce and the training. So briefly the main results, what men told us, as I said, they stressed that it was helpful or important to discuss violence gradually and give words to it, and especially not to be judged as monsters, which is sometimes the feeling that they get, that they're being judged as bad guys and the monsters, and that's not helpful to be able to disclose their use of violence and enter into a change process. And that was the third important message, that it was helpful for them to be given a perspective of change and the possibility of receiving support for a change process, and to receive specific information on the services available to them. Before that, important to know that most men told us that they had never been asked about their use of violence by any professional, even if they were in psychological treatment and if they had been talking about problems in the couple relationship, etc. So that stood out really, that most of them did not have any experience of being asked really in different services. From professionals, the main results are that most of them, 80%, had not received any specific training on addressing domestic violence or abuse in men, and the exception were the men that had been trained by one of the partners in Italy, the social services. They had received some training before by some of the partners in Florence. Less than half of them knew a perpetrator program where they could refer a man to if they detected the use of violence, and less than 20% had ever done so, had ever referred a man to a program. But on the other hand, almost all of the professionals had identified or at least suspected domestic violence or abuse or gender-based violence in men that they work with, but far less had really addressed the violence. So they had not, many of them hadn't suspected or identified the violence, but many of them had not asked about it. And the main obstacles that the professionals referred were a lack of knowledge and skills for asking about the use of violence, of course, the denial and minimization on behalf of the man. The fear of putting victims at risk was an issue for many of the professionals, but also the fear of losing rapport or the therapeutic relationship. So the fear of the man's reaction, both abandoning the service or even violent reactions towards the professionals. But also some legal or deontological concerns about having to report to the police or to the authorities, and also the normalization of violence or their own prejudices and positions towards the violence itself or the men who use it, or the impact of violence on their own personal lives. These were the main obstacles that frontline professionals reported, and that we somehow set out to address in the guidelines in the Engage roadmap and the training. So the roadmap, of course, had the objective to help the intervention of frontline professionals in healthcare, social, child protection services. Even some people at police use it, and others who come into contact with male service users who are violent or abusive towards their female partners. Actually, as we've seen before in the survey from the fundamental rights agencies, it is quite a common request from victims for somebody to work with their partners, to help them change, to hold them accountable, and to keep them and the children safe from violence. So this is a possible key step towards preventing domestic violence, and the roadmap sets out to contribute to this and to taking that steps on behalf of the professionals in frontline services. So I don't know if you've had the chance to see the roadmap. This is the index. It is available in English, in French, in Italian, in Spanish, and in Catalan on the project website. I can also share the link in the chat later on during the break, or put it there directly. So it has some introductory chapters about accountability and victim safety, about beliefs and positions towards men who use domestic violence and abuse. And then it centers on the 4 steps for frontline professionals to address domestic violence and abuse with men, which are identifying the violence, asking men, motivating them for possible referral, and then if that is achieved, referring them to a specialized perpetrator. So it is, the idea is for the roadmap to be used by frontline professionals who get in touch with men who might be violent or abusive. And this can happen mainly in 3 different ways. It might be the men as service users themselves, and some may disclose their abusive behavior spontaneously, which is quite a rare case. Others will rather present themselves as victims of their female partners, but most will actually most probably not refer to the abuse at all, but talk about other issues and demands that they have regarding the service. They might get into touch with the services as partners of the female service users. So some men might insist on accompanying their partners to almost all the appointments, and some even talk for their partners, interrupt them, correct them. And this, as we will see later on, usually is already a possible sign for domestic violence or abuse that might happen in the relationship. These men might appear to be very caring and protecting and very reasonable sometimes to professionals. So it's important to be able to read the possible signs and indicators that we'll talk about later on. And also professionals can get into touch with men as fathers of young service users. They might, professionals might be working with the children. It might be children that we know are affected by domestic violence, but also around other issues, mental health, or even school issues, educational issues. And professionals in these contexts might get into touch with men as fathers.
Helrich, there is a question in the chat from Dawood.
Yes,
there is
please.
a question from Dawood that he asks, what you refer to integrated in your PAI, and how did you identify perpetrators? I think you are just responding to that, to the second one, right, in this moment.
The DVI, domestic violence and abuse, includes physical abuse, physical violence. It includes also psychological, emotional abuse and sexual violence, as well as economical violence. So it is a broad definition of violence and abuse. When we talk about gender-based violence, I don't know if that is the question. And we'll the identification of the perpetrators. That's actually what the whole project is really about, and we'll come to that later, to help frontline professionals to identify, to detect whether a service user might be a perpetrator or might be using violence against their partner and or children. Am I responding to the question?
He said yes.
Yes. Okay, great. So the Engage training package, this was the roadmap, which is one of the main products. The Engage training package consists of a PowerPoint presentation, which includes, and we don't have this today, but in the 3 partner countries, we had a video of a man, a perpetrator, talking about his violence, and it also includes some practical exercises for each of the steps of the roadmap. So for identifying, asking, motivating, and referring. And I hope we'll have time in the second part of the workshop to try some of these out. It includes short guidelines on delivering the training, and then there is a training plan. Of course, everybody who uses this can adapt the training plan and use it in different ways. But what we have been doing so far during the implementation and during the trainings that we've delivered since is 1 or 2 initial training sessions of around 6 hours. Sometimes it's 1 6-hour session, sometimes it's 2 3-hour sessions, covering the main contents of the training and capacitating professionals to deliver the four steps, and then have a follow-up or booster session around 3 to 6 months later, of usually about 2 hours, to review the transfer of what has been learned into the practice, review difficulties, possible difficulties, what has worked, what hasn't, and even have talk about some possible cases, do some kind of a small supervision, mainly with the idea to help the transfer into practice, because the experience with many trainings has been that, yeah, we do the training, very nice, but then it is sometimes difficult to really apply what has been learned in the work context. So to have this follow-up session has shown quite helpful to contribute to really applying what has been learned in the individual work context. And sometimes what we ask people to do at the end of the initial training session is to have a small action plan for how they want to apply what has been learned in their specific contexts. Sometimes this includes clinical sessions with their teams, or using that with the teams, or establishing smaller protocols in their work. So these are ideas that we sometimes propose to guarantee usability and transfer of training contents to people's work, daily work. Okay, so the pilots that we did, actually we did some pilot trainings before the implementation to try out the materials and this training plan that I talked about, and that was done early 2019 with 90 participants in Florence. The partner in Florence was responsible for the training development, so they did these pilot trainings. And after that experience, we changed some small things in the training program to then implement it in the 3 countries, in Italy, France, and Spain, where a total of 15 groups had the initial trainings. Unfortunately, it was not possible to have the booster session, the follow-up session with all the groups by the end of the project, but 154 participants in 12 of the 15 groups did receive also this last booster session. So we had a total of around 400 people receiving the training all in all. The evaluation that we did consisted mainly in questionnaires to be filled in by the training participants at 3 points in time. The first was the pre-test before the initial training, and it mainly was around knowledge and skills in addressing domestic violence and abuse in men. So the feeling prepared to do this, but also we asked for the number of perpetrators they had identified and the number they had referred to a perpetrator program in the last 3 months, so in the 3 months before the initial training. The second point in time was directly after the initial training. Again, it was around knowledge and skills and feeling prepared, and also about their evaluation of the training, the quality of the training. And then the third time where we used the evaluation was in the follow-up session. So after the booster session, again, we asked about how prepared they felt to deliver the 4 steps, but also about their experience of the roadmaps, and again, the number of perpetrators they had identified and they had referred in the last 3 months, which is after the initial training. And the second measure we used for evaluation were the referrals that the perpetrator programs in our partner organizations had received from the services in the who had participated in that training program. So we looked at the referrals that the 3 participating perpetrator programs had received from the services that took the training in the 6 months before the training and in the 6 months after the initial training. It was like an approximate measure of the referrals, a possible change in referrals to the perpetrator programs. And these are some data on the changes in feeling prepared to deliver the different steps of the Engage roadmap. This is about identifying the signs and indicators of domestic violence in male service users. And as you can see, there is a clear shift from seeing the majority of people feeling slightly or moderately prepared to moderately and fairly well prepared. And this is the same pattern actually for the four steps really. This is the question about asking men about violent behavior, and here the changes even more marked from not feeling prepared slightly or moderately to the majority moderately or fairly well prepared, and some even well prepared after the training. Pretty similar for the third step, which is motivating men to seek help and change their behavior. So most professionals did not feel very prepared, or even not prepared slightly, some moderately, and then it shifted towards moderately and fairly well. Not spectacular changes, but there is a clear shift, which is more marked in this last step, the one of making a referral to a perpetrator program or a specialized support service. So here we can see that by the end of the training, the majority of professionals felt moderately or even fairly well prepared, and some well prepared on this scale of 5 points. So we can see this shift in feeling prepared, but there has also been changes in the behavior, both according to professionals themselves, but also with regards to the referrals that were recorded by the perpetrator program. So we've had reports on changes, and this is at the follow-up session, from pre to post, from 120 professionals. So the blue columns are about the number of men, the mean number of men that professionals said they had identified as perpetrators, where they had identified domestic violence and abuse. So this changed from a mean of just under 2 men to almost 2.5. And the second column are the referrals that professionals said they had made to perpetrator programs, and the mean changed from 1/3 to 2/3. So it practically doubled the number of referrals that professionals said they had made to perpetrator programs in the 3 months before the follow-up session, which was usually about 6 months after the initial training. And on the other hand, in the participating perpetrator program, there was an increase of about 20%, 25% in the referrals that were received from the trained services or areas. And we know that this is not the most exact measurement, probably because there are other perpetrator programs that these services could refer the men to. But we did notice this increase on referrals to our programs, so the programs that were run by the partners. So these are quite promising results in the evaluation of the pilot implementation. And if there are there any questions about the the project itself, the different steps of the project, or as part of the evaluation? Please go ahead.
First of all, thank you so much for what you have shared so far. It's very powerful to see the impact that this project is having in many countries in Europe. I see that I had a wrong idea about what you are going to present in terms of specific services for men who are engaging in violent behavior. This one is wider in terms of those who provide services, human services, being prepared to respond to this pandemic of violence, of men's violence against women and in the family. But that this requires, in order for a project like this to be considered in other contexts, it requires that these perpetrators program are in place, correct? Otherwise, there is no point.
Yes. Yes, it ideally, of course, and that is an issue in many countries, and it is even it is an issue here in Spain for us. There is no general coverage. Many countries for perpetrator programs that professionals can refer the men to, but we still think that it is important to ask about the violence, even if there is no perpetrator program to refer to send the message that this is an important issue, that it is your issue as a man, the violence, and that I, as a professional in our service, does take this seriously. If there's not a perpetrator program at hand where you can refer to, and then of course services will have to think about how to deal with the issue, which kind of support they might be able to offer. But it still seems important to participate in making putting the issue on the table, making it visible, trying to hold men accountable for it, which is a bit the shift in perspective that we talked about, and to not think about women when we think about gender-based violence, but to at least also think about men who are the root cause and who are using this kind of violence. So yes, of course, it is difficult if there is not a program that we can refer to and that we can collaborate with and coordinate with. But we still think that it is important for service providers, for professionals in frontline services to think about it and to ask, even if they cannot refer.
Thank you. There is a question from Sarah in the chat. Have you
in the chat, or go ahead and ask it out loud?
Yes,
Sarah.
Hi there. I just wondered if you found that porn's had an effect on violence or increasing like sexual violence.
Sorry?
Pornography.
Oh yeah, we didn't look at this in this project because we actually did not interact directly with the men in this project. So what we worked only with the professionals, and all the evaluation is also based on the professionals report only, except in the needs assessment part where we talked with some men on programs. But generally, of course, the experience shows, and many studies show, that porn, especially violent porn, has a clear effect on the use of violence generally, but especially sexual violence in men. And it is, I think, an important and pressing issue for us to address preventively. And I don't know about situations in other countries, but at least here in Spain, emotional and sexual education in schools is almost inexistent and very much centered on biological issues, disease prevention, but it's not really a relationship and sexuality training that would address, very far from it, that would address pornography and prevention of sexual violence. So yeah, I think that is quite an important and pressing issue to be addressed. And in our experience in the perpetrator programs, the sexual violence, so we do talk with men, at least in our program Connexus, we do talk about pornography and its influence in their sexuality and in the possible sexual violence that they use. But the experience is also that sexual violence is probably the hardest to admit for most men in the perpetrator programs, and we need to especially really address it to be able to work on it. It's more difficult, more shame-laden than other forms of violence, in our experience at least. But this is from other experiences and from other projects. In the Engage project, we did not specifically ask about porn or its influence on sexual violence or other forms of violence.
Thank you.
Are there any other?
I can ask one more if there is no.
You go ahead, Osvaldo. Yeah, please.
Do you know if some refer to hotline services for men who can just make a call, receive some counseling, some support over a conversation online or over a phone? If that's one of the options of referral. And second, if there is also as an option, not precisely to perpetrators program, but to programs that contribute for them to their more holistic development, or on overcoming restrictive gender roles, not focus on violence, but more human development or gender transformative program for men. Yeah.
With regard to the first question, I think the hotlines for men are really a good idea, and some countries, especially due to the COVID pandemic, have started to set up hotlines. For example, in Austria and in Germany, I think these hotlines were set up due to the restrictions and the lockdown in the pandemic that went along with an increase in domestic and gender-based violence for different reasons. So I think yes, it's a good idea, and it might be easier for men to make a first contact over the phone or over email or some chat. That's usually an option also with the hotlines. But in many countries there aren't any specific hotlines. I think there's a long experience in the UK, in Australia, but there are not many specific hotlines in place for men around gender-based or domestic violence. And I think they are helpful always, but especially with the pandemic going on, the difficulties to do the face-to-face work or group work, which is a whole other issue. To how do services accommodate to adapt to the conditions, and yes, I think any work that men can do around their masculine identity, around gender roles and expectations towards a transformation and deconstruction or reconstruction of their identities would be helpful also in reducing their use of violence. For some, that might not be enough, and there would probably need a more specific program to address the violence. But it is probably for some other men a lower level entry to some of these problems. The issue is that there are also not so many of these programs, at least with regard to public service offer. There's probably few countries where there's a clear public policy and service offer in that. Some, of course, some associations do offer these kinds of groups. There's some men's groups that can be helpful in the first step. But as I said, with some of the men who use a higher level violence and might have higher risk of reincidence, these groups might not be enough to hold them accountable and to guarantee or contribute to the safety of the women and children. I don't know if that makes sense.
Yes, thank you.
Okay, any other?
Hello.
Yes.
Sorry, I was late, but it was very interesting. I have a question. How do you identify those perpetrators? Like, where do you find them? They are knocking on your door, like, "Hello, we are perpetrator," or
well,
or how do you identify them? Yeah, that's
actually,
my question.
Yeah, that's the question, and actually the whole project and the Engage roadmap and training are about this, on how to help professionals working with men in health context, in social services, in any context actually of service provision, how to help them identify possible perpetrators, and how to ask men about it, to confirm this suspicion that they might have this, and we will go through some of the indicators and some of the signs that might be helpful for professionals to think, well, this man might be using violence and I should ask him about it. So this is what the whole project is about, helping professionals to identify the signs and possible signs and signals that a man might be using violence, and then helping them to ask about it, to confirm whether they are or not, and if it is confirmed, to motivate them for a change process, and if that is achieved, then refer them to a program if we have one at hand, and if not, then another strategy must be used. So we will be talking in the second part of the workshop. We will be talking about especially this: what are the signs and indicators of domestic violence that professionals can identify in the men they work with, and how can they then react and ask the men about the violence while not putting their partners at risk.
Thank you.
Yeah.
Shivan has a question. Would you like
Go
to?
ahead, Shivam.
Hey, Rich. Thank you for the presentation. What are some of the challenges, major challenges that you come across when you guys are dealing with either yourself or your team? And what do you think of that? What are the reasons?
The challenges in the frontline professionals' work to identify the violence in men.
Yeah.
The main challenges are really that professionals, as I said before in the results of the needs analysis, that they have not received any training or guidance on doing this, so they don't know what to do really. And on the other hand, they are afraid of asking men directly about it, even if they are quite sure that the men might be using or could be using violence. They are afraid about directly asking the men about it because they fear that the man might react angrily, that they might use violence against the partner, so they might put the partner at risk. They are also sometimes afraid of violent reactions towards themselves as professionals. They are afraid of the man abandoning the service, like the effects on the working relationship that asking the man might have. And so a lot of the work in the trainings has to do with helping professionals with the skills and the knowledge that they need, but also to change this attitude and helping them see and transmit our experience that it is okay for most of the men to be asked about violence quite directly if it is done with respect and without judgment. So it's oftentimes it's more our own stereotypes or our own conceptions that hinder us from asking about it, rather than the men's ideas. Of course, there will be men who will not admit to using violence, who will lie, but there's probably not much to do about those in this context of the frontline professionals. But there will be many others, and we've heard that from some of the men we talked to, who are actually quite relieved when somebody finally asks them about it, and when they are offered some kind of a perspective of a solution or of a change with regards to that issue. So that, to me, seems to be one of the most important. So there's a challenge about knowledge and skills, but there's also this challenge in the attitude or in the perspective or the beliefs really of professionals around it. And once they start asking, and once they see that these fears of the reactions of the man are not justified, and that it is okay to ask, and then it is a lot easier to keep doing it and to practice.
How about in terms of opposite sex, talking about mostly men, but causing violence and everything. But how about opposite sex when it comes to female or the gender? You know?
Mm-hmm. Yeah, in this project, we have limited ourselves to the to the dominant and most frequent constellation of violence by men against women in heterosexual couples. I'm not sure. We would have to think about it, whether or to what extent this model can be applied similarly to female perpetrators or to violence in LGBTIQ relationships. Probably some of it would be transferable with regard to the indicators and the way of asking about it. But I don't really dare to affirm that, because we have not tried that. We haven't looked at the literature around that. So
in your project so far, have you come across or any cases or anybody talked about it? Okay, you know what, I had this and this, something like that from the men's perspective, right? Woman was causing that problem, something like that.
For men as victims of domestic violence or violence in a relationship.
Mm-hmm.
Within this project, not, but yes, of course, there are also some men who suffer violence from female partners. I mean, the percentage is, of course, very, very low in comparison to male perpetrators. But yes, there are some, and there are some few programs for men who are victims of domestic violence and abuse. Especially in the UK, there's quite an experience, and in the US, there are also some programs for female perpetrators. But it is important when addressing and offering services for the male victims that this is really done quite carefully and by professionals who are also knowledgeable in the work with perpetrators, because the experience also shows that quite some men present themselves as victims, but are also perpetrators or mainly perpetrators. So we have these three types probably of men who might present as victims of domestic violence. Some of them are really mainly or exclusively victims. Some of them are both victims and perpetrators. So there is mutual violence in the couple, and some of them are mainly or exclusively perpetrators, but present themselves as victims. So it is important when offering these services to male victims to take this into account and to really carefully screen for that and make these distinctions.
Sure.
But this is not my main field of expertise, really, the work with male victims. Okay, looking at time, I'll start, if that is okay, to tell you a bit about the Engage training package and give you like a teaser, run you through some of the training. So at the start, we really try to make it clear for the frontline professionals that we work with what their role is with regard to the men who use violence. So to make it quite clear that they are not responsible for providing the specialized service to help the men stop their violence, to what the perpetrator program would do to really deliver the whole behavior change process. But that they do have a responsibility and a role to hold the men accountable together with the other involved services, to hold the men accountable for their behavior and to support a safe intervention also for the victims, and assuring that they receive adequate support, and that therefore we suggest that they should have the knowledge, skill, and the confidence, the attitude to effectively identify, address, and refer the perpetrators, so to deliver the 4 steps of the program. It is important, as we said in the beginning, that we do not forget the importance of a coordinated community response that focuses on the safety and well-being of the victims and survivors, so women and children. And this has to be our guiding principle and priority from the start, even when addressing violence and abuse in the frontline purpose. So we have to take that into account and guarantee that the system as a whole, the coordination between different involved services, acts in appropriate ways. And to do that, we try to transmit and work on some good practices for victim safety. So it's important to make sure that all the information that might be provided by the victim remains confidential, and that the effects of violence are acknowledged and recognized. It is important with regard to the change process to be aware of the expectations that women might have about the change and the impact these expectations might have on their decisions to leave or to return to the man. So it's important to avoid unrealistic expectations about the man's change. It might happen, but there's no guarantee, and it's important to help women protect themselves despite these possible expectations. Of course, any form of couple counseling, therapy, or mediation in cases of domestic or gender-based violence is not safe and should be avoided. It is important to take into account the possibility that perpetrators might try to manipulate us as service providers, and therefore we have to do our best to hold the men accountable for their violence and avoid any form of victim blaming to which he might try to convince us. And it is important that even when working with the man, we try to help providing support of specialized services to the victims and survivors for risk assessment, for empowerment, for recovery and safety planning. For example, in our perpetrator program here at Connexus, we find that half of the women that we contact as partners of the men we work with are not receiving specialized support. And after the contact we do with them systematically, the half of this half do decide to look for this support and finally receive this, which should make them safer, even if we don't succeed in working with a perpetrator. So the provision of support and services to the victims is an important issue to take into account. So then we have this part on who commits violence and what are our images, ideas, fantasies about the men who use violence, and the difficulty sometimes to imagine that very nice guys might be using violence too. And we use, as I said, a video usually of a man talking about his behavior and the consequences of his behavior to the partner and children. And this is mainly to help frontline professionals be aware of their emotional responses to the man and his discourse. Usually, these are different mixtures of emotions that come up in professionals while looking at the video. It is repulsion, fear, sometimes anger, disgust, sadness, and it varies according to gender. So women's reactions often are different, especially if they have been working with victims or have had experiences of violence themselves. So the idea and the issue is to be aware of these emotional responses that the men and the violence they use triggers in us, and to be aware about how these emotions might influence our position and our relationship with the man, our response to him, our ability to address the violence with him. So it seems very important to us to help frontline professionals to be aware of these emotions, and very understandable, of course, and emotions, but it's important to be aware of them so they do not inadvertently influence our response. And it might be the best thing sometimes for a professional to decide not to work with a man who triggers these kinds of emotions and who is talking about his violence and his justifications, his ideology, his sexism in these ways. So we do this exercise with the professionals, and this helps us to start a discussion about the ideas, the beliefs about the men who use violence and abuse, the perpetrators, and they, of course, do also influence our ability to respond to the service users adequately. And some of these stereotypes we usually do some exercises around it. Some of the typical ideas is that the violent men will never change, or that they are only violent because of alcohol or substance abuse or a mental health problem, and then that perpetrators can be good fathers or good fathers, or that they are all terrible fathers in all the aspects, or that our perpetrators were abused as children or witnessed domestic violence as children. So these are typical stereotypes, typical myths that we find when working with frontline professionals, and that we try to discuss, transmitting some basic ideas that there is no single profile of a violent man or of a perpetrator that would help us really identify them, that there is no single causal explanation of any of the levels of the ecological models, or biological, psychological, relational, or cultural or social, no single cause for the violence, but that it is rather a consequence of an interplay of different factors on different level. There's quite a complexity in understanding the man's violent behavior, and that traditional models of intervention, psychiatric, psychotherapeutic, and psychosocial interventions, are usually not sufficient to change or stop the violent behavior if they do not have a clear model of change based on this causal analysis, based on the different factors that contribute to the use of violence, and specifically a clear gender perspective and the use of violence as a consequence of traditional masculine identities and ideas, traditional ideas on gender relations and relationships, and that men need to be made accountable for their behavior through, as we said before, the coordinated community response. So we have this discussion with service providers, with the professionals around these ideas and stereotypes. Do we have a question, Osvaldo?
A comment from Sarah. Sarah, you want to express your comment?
I just put, I think often people don't realize what they're doing is a form of violence. So like sexual harassment, which is absolutely rife in the UK, okay, and across the world, you know, whether it's, you know, whistling at women in the street, or, you know, grabbing a girl in a nightclub. You know, I have a 20-something-year-old daughter. Every single young woman she knows has been touched in a nightclub in an inappropriate way, and lots of guys just think that's okay. But it's a sort of it's a either a public awareness or a training thing. We've had ads on TV about consent. You know, what is sexual consent, and all our university students are shown a video on what is consent. And we've had things on sort of controlling behavior as well. But I've never seen anything on, you know, sort of what is acceptable behavior, or like you say, where to go for help. You know, if you as a male have a problem with violence, that you are perpetrating, I've never seen anything that says this is where you can go for help, or it's just it's not, although everybody knows it's all happening, there's it's sort of hushed under the carpet.
Right. Yeah, that is one of the big issues that also came out of the needs analysis, the normalization of violence, both in society in general, especially these kinds of sexual harassment that you're mentioning, and also among professionals at some points, that they really do not sometimes do not identify certain times certain behaviors or certain issues as violence, that they should intervene. And you're saying that about the UK, where there is quite a developed system. I mean, there you have the respect phone lines for the perpetrators, and so in other countries it might be even there might be even less coverage or less awareness among the society. And I think here what's really so important is that we help men to address other men's sexist comments, other men's harassment, and through what's called the bystander trainings to create like a critical mass of men who oppose, who hold other men accountable, who address other men's sexism and what you could call low-level violence that now goes unrecognized or unaddressed. I think that, as you say, that is quite a big challenge and important issue.
Yeah, and in every workplace, it is a problem. I mean, not every workplace, of course, but many workplaces. And like in Rwanda, you know, I can't remember, there's a term for it, sextortion. Whereas, you know, if you want a promotion or if you want whatever, you're expected to do certain things or behave in a certain way. You know, and that just seems, it has to be held up and people made accountable, as you say.
Right. Yeah, thank you. So we do talk a bit about these about these issues, about these ideas, about the normalization, about the different ideas that professionals hold about violent men, and how these ideas might affect their ability to identify and address the issue. With all this work on the stereotypes, the ideas, the beliefs they hold about the emotional responses, that are triggered by the man's discourse and the man's behavior, what we try to convey is the idea of the working relationship that we suggest professionals have with the man, and which is quite challenging to hold this balance between a clear positioning against the violent behavior and the supporting beliefs and discourses, which we have to challenge, of course, and on the other hand, an acceptance of the person as a person, and intent to understand their experience and their story, and to not fall into this invitation or give in to this invitation of position of superiority, professional, moral, personal, in which we believe we are different than them, we are better than them, and we should make them see what they should be thinking or doing, or stop thinking or doing, which is reproducing the exact same relational pattern and practices that they use with their partners. So I am different than you, I am better than you, and I show you what you need to do, and if I need to do violence to show you or to make you do it, then I will. So there is this, it's quite easy, and I've fallen into it so many times, this invitation or this idea that I am different than them, I am better than them, and I should be telling them what to do and what to think, which is a power relationship. I'm different, I'm better, and I have to change you, influence you, make you see, make you change. So this is quite a challenge to see how can we relate in a way that does challenge your behaviors and beliefs and discourses, but that does not reproduce a power relationship and coercive process. So this, to me, both in, especially probably in the perpetrator programs, but also in any kind of relationship that we have with men who use violence, is quite a challenge, and they react to it, and that's where this demand for being respected and not being judged probably comes from. In the roadmap, we talk about adapting a concept from Kate Ivey and Chris Newman. In one of their books, we talk about these three possible relationships or positions towards the men. The collusive one, where we just easily create an alliance and do not question anything of their behavior or thoughts, but are empathetic with their feelings and stories. On the other extreme, we have this very confrontative position where it's very difficult to create a working alliance. It's rather a relationship of opposition, and where we constantly challenge, question their point of view, don't empathize at all with their experience, and really point out their wrongdoings and how badly they do and they behave. And the proposal is to try to find a balanced position where we can both empathize and try to understand, as I said before, but also question their violent behavior and their thoughts, and try to invite them to challenge themselves. You can find that in the roadmap and some more explanations around it. Okay, well, I'm a bit aware of time. How are you doing? Should we make a short break and then go through the 4 steps? How do people feel? Osvaldo, what do you think as co-host?
That's a good
I
idea.
think we can go on, or I don't know.
Hariaka suggests to continue. All right.
But a short break might be good at some point. Okay, we can go on for maybe 10 minutes and then have a 10-minute break. Is that okay?
Okay.
Yeah?
Okay.
Okay. So step 1 in the roadmap, in the process, is identifying the violence and abuse through signs and indicators that professionals might be aware of. So the man might present to the services for different problems, health-related problems, psychological ones, relational problems, or if it's in social services, economic difficulties, substance use. And some of these problems might mask the problem of domestic violence and abuse. Some men present to services after a crisis related to the violence they use, after an assault, after an ultimatum by the partner, and they would most probably blame others, mainly the partner, for what happened, and probably minimize or justify their abuse. they might be accompanying, we've said that before, the partner, or they might be coming to the services related to issues around the children, childcare, visitation rights, sometimes educational issue. But as we said, he will rarely spontaneously bring up the issue of violence and abuse. So it is important to think about indicators that we can use to detect, or at least make you suspect, that there might be domestic violence and abuse. Maybe we can, Osvaldo, can we have a short breakout room, or how many people are we now in there?
Yes, we have 10 right now. Well, 9, because I think Tamizan would not join. Well, so we are 9.
Okay.
We can create breakout rooms whenever you say so.
Yeah, maybe people can just share what the ideas are. So how, if you work with a man in social services, in health services, what would make you suspect that he might be using violence against his partner?
To be honest, I have no expertise in this, but I'm really interested.
Yeah.
You know, what would be the kind of signs or indicators that would make a service provider think, okay, maybe there is a case of domestic violence here, or violence taking place. And yeah, I would imagine that that's seldomly shared explicitly. And of course, there can be very clear signs of bruising when there's physical violence.
But that's usually more in the victim, and it's rarely. Yeah, sometimes in emergency rooms, this is what things that you might be using.
But I have some experience of couples therapy where the therapist basically just directly asks both, you know, are you experiencing violence in your relationship?
In couples therapy, wow.
Yeah.
That is, I would recommend to do that separately always, because it might put the victim at risk, really.
Yeah.
Especially if it's high level violence with a power difference in the relationship. It would probably, she would either be afraid to tell the truth, and then it is not effective, or she would tell the truth, and then that might have terrible consequences for her afterwards. So.
Right. Yeah. So, Honette, I'm not sure if you have any thoughts on this. What could be indicators that there may be violence?
Yeah, I think we have everybody back in the room. So maybe you can briefly share from the different groups what the main ideas were around possible indicators or signs that might you make suspect of a case of domestic violence, gender-based violence. Who wants to share? Please go ahead.
Well, we can share in our group. One sign that was shared was men who, when you disagree with their opinions, getting angry because of that, or getting disturbed, go along with not being not capable of tolerating dissent, tolerating different. And another was about men with expectations of like entitlement expectation, feeling entitled to lead, that they as men have to lead their couple relationships, for instance, in an heterosexual. So that kind of more macho ideas that as males we are the ones who are the leaders. We have to show that power.
Right.
But we were discussing that it might happen the other way. We might face with men who look shy and weak, and who could be very, very harmful in the intimate space.
Yes.
We're talking about that as well.
Yeah. We sometimes have that some of the men who use violence are very compliant and very solicitous with professionals, partly because they have this hierarchical idea sometimes about relationships, and sometimes because they just want to hide their issue. But yeah, that's these are important issues. What you've mentioned, when we notice that they get angry easily, even in the relationship with us as professionals, and we might imagine what could be happening at home, and if there's sexist ideas or ideas of entitlement that they or express or put at play in the sessions, that is also an indicator that might make us suspect and might make us think we should ask about it. Other thoughts in the other groups? Who was in the other group? Would you like to?
Sariaka was in another group.
Yes, but we had the same answer as Osvaldo said. Like it's about the sometimes they are aggressive, or it's about behavior, but it can be the opposite also. They can be like very polite and gentle and and in public, but then very aggressive with the intimate partner. Yeah,
fully agree. So if they are aggressive or easily getting angry, that is a clear indicator. If they are polite, it is not an indicator that they are not necessarily violent. It's not an indicator that they are, but it's also not one that they are not. Okay, thank you. I will just share some of the indicators that we suggest in the roadmap and in the training. Usually in this frontline professionals have quite a wealth of ideas about indicators. So mainly what we can distinguish is indicators in the man's discourse and what he says, and indicators in what he does and how he behaves in the session. And within the last category, we can also distinguish. We only just said something about the couples session, so it is interesting to take into account the information that we might have if he attends with his partner, and the differences that we might be observing as professionals when we see the partner alone and we see the two together. So, but I'll come to that later. The first indicators are around the man's discourse, so what he says, and of course the obvious cases that he might be talking about violent or abusive behaviors directly, be it physical, sexual, emotional, or other types. That is quite self-evident. He might be referring to jealous behavior and controlling behavior over the partner, that she has to always tell him where she is, what she does, who she is with. Some of the men within the ideas around romantic love, they might find it easier to talk about jealousy than to talk about controlling or violent behavior. And as you've mentioned, they might show sexist or misogynistic attitudes or make sexist comments, be it about the partner or be it about women in general, sometimes even about the professionals. And they might use like euphemisms that could indicate any of the above. So they might be talking about a big fight or a strong argument that they've had with their partners, and that might ring a bell. And we might want to ask him about what he specifically referring to when he says a fight. So what's happened? What did you do? What went on? So these are the things that we can observe in their discourse that might make ring the alarm bell. In the man's and in the partner's behavior, we can also observe different indicators or signs that might make us suspect. And as we said before, if a man insists in always accompanying the partner, even doing routine visits, and always wants to be in the sessions, and especially if we feel that she is a bit disappointed when he's in the session, that might be an indicator, especially if in the sessions then he speaks for her, interrupts her, corrects her, doesn't let her talk, discredits or devalues her, or tries to make decisions for her when it's her health issue, for example, that's been talked about, or when he justifies or minimizes the partner's health problems or injuries or psychological states, which might be due to the situations of violence. In general, when he blames her for his problems, that is something that might be a clear indicator. As you've mentioned before, if he shows difficulties in managing, regulating his emotions, his anxiety, his stress, if he has mood swings, raises his voice, gets angry easily in the sessions, that might be an indicator. And as we've also mentioned before, there might be one of two apparently contrasting attitudes or behavior, being very silent, defensive, refusing to answer questions, or also being overly talkative or even foul, very compliant, very smiling, and very present and attentive, especially during the interviews with the partner. Of course, if we see a threatening non-verbal attitude or gesticulation, if he invades the partner space or our space as a female professional, that might be an indicator. Sometimes men are violent or abusive towards the partners during the session or in the waiting room. That is, of course, quite self-evident. He might be trying to control or manipulate the partner or the professional or even the situation, and that has to do with what you've mentioned before around entitlement. So he might be trying to control the type of questions that can be asked in the interview, or the duration of it, make it longer or shorter according to his view. He might disqualify female professionals as women with demeaning or aggressive attitudes towards the female professional. Sometimes also he might be flirting or sexually harassing or approaching the professional. That might be an indicator too. And again, there might be indicators in the partner's behavior when he is in the session. So if she lowers the gaze, is silent, or puts herself in any kind of submissive attitudes in his presence, that is a good indicator. And if there are clear differences in her attitudes or behavior between the sessions with the man and with her only when she's on her own, that usually is an indicator when she somehow cohibits herself in his presence. And also there might again be these apparently contradictory situations in the couple. They might be very conflictual, accuse each other in the session, but sometimes also a very exasperate sense of perfection, nothing's wrong, no problems at all in the relationships, denying any type of difficulty or conflict. That could at least be also an indicator or make us suspect. And again, it's important that probably very few of these are on their own. Some of them, yes, but in many cases, it's probably the combination of different of these indicators that might us take the decision to say, okay, let's ask about this. Yeah. Are there any questions about the indicators?
Heinrich, more than a question is a reflection about how tricky this could be for professionals to assess, because it might mislead. I mean, many of these behaviors, not necessarily by itself, tells you that there is violence going on or abuse going on. So it's kind of tricky. So how they, based on these indicators, what is the next step? How they
exactly, and that's the good thing. We don't make a diagnosis based on these indicators. We don't make any kind of judgment or sentence. We just decide whether we ask about it or not. So we can't really do anything wrong. It's just and the recommendation is really, if there's any of these indicators that might make you suspect a little bit, just go ahead and ask. And if you are wrong with your suspicions, then that's fine. There's not much danger of doing harm asking about it, as I said, in a respectful way. And this is what we're going to look at after the break. How can we then, if we have some indicators, if we suspect that there might be a use of violence, how can we ask about it? But I think as well, that's an important question. And these indicators some are stronger, some are not very strong. But as I said, the good thing is that you don't need to get it right. You just decide on whether you ask about it or not. Would it be good to have a short break? I was going to try to do a little exercise on the indicators with you, but I'm a bit afraid that we don't have much time really. But we can do so. I will put this document, the link to this document. It's a little case study in the chat, and maybe the document itself. So after the break, we can have a look at that together. Welcome back, everybody. Sorry about forcing you back and probably interrupting your discussions, but we're a bit short of time. So, what are the first indicators or signs that you have observed in the little groups, in the pairs?
He criticized a lot his partner.
Yeah.
He sees his partner as not a good mother, not setting good rules, not being that's one sign.
She's lazy, she doesn't want to work, she doesn't do a good job as a mother, doesn't take care of herself, the house, right?
Yeah.
Even before the criticizing, this is already quite clear. In the first paragraph, has anybody found any possible indicators? We can't hear you yet, Sarah.
He's the victim.
Sorry?
He's the victim.
Exactly. He's the victim. We could even think about the bad situation in the family, but especially when he says, I'm a victim of a plot, he presents himself as a victim. That clearly can ring a bell. Yeah. Great. Thank you, Sarah. So we've had the different criticisms in the second paragraph. What have people found in the third paragraph? Go ahead, Sarah.
Is the euphemism? He gave her a small shove. It was so small that it resulted in her going to a lawyer.
and to the hospital first, right? Exactly. So this is this is already pretty clear here. He says he calls it a small shove. That is the minimization, but she had to go to the hospital because of it. And of course, he says, well, she's always exaggerating. That's not. So this is the typical minimization. Before that, we have the issue of the grandmother. So the comparison between the mothers, and she wants her to separate more from her mother and bring the kids more to his mother. So we have this indicator of this social isolation to some degree, a possible indicator here. So he wants her to distance herself from her mother. Also, we have what could be understood as an intent to create some alliance or maybe manipulate us as professionals when he says, well, yeah, you are the experts, but you know, these things are passed on from moms to daughters. Possible indicator here of trying to ally with us, collude with us as professionals. And then just before the issue of pressing charges and going to the hospital, we have that they often end up arguing. So this might be a euphemism too. We don't know what's behind arguing. But if arguing leads to shoving and that leads to hospital and pressing charges, possibly there's more behind that word of arguing. All right. In the final two paragraphs, what else can we find?
Well, he's asking for couple counseling, which is something that you explained is not recommended, and also he's seeking for recognition in some way. There is no sign of self-awareness about his own limitations. It's like Donald Trump talking about how good he's the president. Sorry for the politics.
Yeah. So it's in the very last. So he would be willing to do couple counseling, and this is, we could talk a lot more about this. This is a possibly dangerous issue in situations of couple violence. In the best of cases, couple counseling is if there is a power differential, controlling behavior, and violence in the relationship. In the best of cases, couple counseling is ineffective because if one partner is afraid of telling the truth because of what the consequences would be afterwards, it just will be ineffective. It might be dangerous in the worst of cases if she does disclose and if she does really say what she thinks and what happens and discloses the violence that she might be suffering. So very important that couple counseling is contraindicated in cases of domestic violence. And sometimes even women ask for it because they know, as in the case of Richard, that this might be the only way for him to do anything, to attend any kind of service or any kind of counseling. So the women sometimes agree to that or even ask for that because not because they think it's the best option, but because they believe that it's the only possibility for him to do anything at all about it. And it's important then to really, if we want to clarify this, to have before a couples process single sessions to really screen for violence, and if there is violence, then not do any couple counseling or couple sessions. We have also here the issue of separation, which might be a risk factor. We know that domestic violence tends to rise, and some of them feminicides, the murders happen during or after the separation. So this issue of separation has to be taken into account. And also we have the issue here of jealousy. We say, well, what if there is another man? What if this is only an excuse and she has another man? So another indicator that we have here in the second to last paragraph. So as we can see, there is quite a lot of indicators here. Some are stronger, some are maybe less clear. And the next step, so if we've, and then I'm a bit aware of the little time that's left, the next step, and I will share the screen again, after identifying the possible signs and indicators, is then to ask, in this case, Richard, about his possible domestic violence and abuse. And I will rush through these a little bit so we can go through the 4 steps, even if briefly. But it's important to create an environment of privacy and safety that would facilitate disclosure to the man. Especially important here that the conditions of confidentiality are clear to the man. And of course, these depend on the service and on the legal context of each service in the respective countries. Again, in our needs assessment, in our interviews of the men, many of the men remember being asked about the violence as an important factor to be able to open up, and that they'd never been never had talked about that before. Sometimes to anyone, sometimes to a professional. So the experience is that they are more willing actually to be asked about the use of violence than we as professionals sometimes think. Again, with regard to what we've said about couples counseling, it is important to not address the issue in the presence of the partner, so only with the man alone. And the proposal to ask about the use of violence is to explore it with progressive questions, from more open and generic ones to more specific and focused ones. And you can you find what we call the funnel questions on the page 17 of the roadmap. So we can distinguish between general funnel questions that we could actually, even without any kind of indicators, ask men at any point in the process. So how are things at home? How are things with your partner? How would you describe your relationships? We could say most couples argue sometimes. How do you and your partner argue? How do you handle conflicts and disagreements? How do you normally act when you are angry? What happens when the anger gets worse? So these are quite general questions that do not have to do anything yet with violence. Do you think your partner or children are ever scared of you? This goes a bit more in depth, and of course, you would not ask this series of questions, but the follow-up questions would depend, of course, on his responses. And another possibility, of course, is to catch any of the indicators that we've talked about and start the conversation there. So if it says, yeah, we often argue about this, then you could ask, so tell me a bit about the worst of these arguments. What happened then? Or if he says about the shove, then you could ask about, well, what happened with the shove and what were the consequences, etc. But if you don't catch any of the indicators and ask about them in the moment, these funnel questions are a way of starting these kinds of conversations about the use of violence, or that would lead to the use of violence at any time, actually, of the process in working with a man. So, do you think your partner or children are ever scared of you? Have you ever said or done anything that you later regretted? Or have you ever acted in a way that embarrassed you or scared you yourself? Then there are, depending on the answers, there would be more specific questions. Have the fights ever become physical? Are you ever worried yourself about your behavior? There's questions about jealousy. Do you feel jealous when your partner is with other people? What do you think of your partner studying or working outside the home? What do you think of your partner spending time with her family or friends? Do you shout at your partner, or do you think you sometimes treat her in an authoritarian way? So there's different questions on different types of violence that can be asked in this ever more specific way, depending on his answers. Then, have you ever threatened to hurt her or with a weapon? These are questions that then would also help us to explore the severity of the violence and the risk that he might be posing to his partner. Then you could ask about that, if the police has ever had to come to their home because of any fight. And the other type of funnel questions, also on page 17 in the roadmap, are related to the presenting problem that you might be working with him. For example, in a health service. So if he comes for alcoholism or stress or anxiety, you could ask, how has your problem of anxiety, of jealousy, of alcoholism affected your relationship? In which way? What does your partner think about this problem? How does it affect her? And when you are jealous or drunk or nervous or anxious, how do you react with your partner or children? Or when you have been very nervous or drunk or jealous, have you ever lost your calm with your partner or children? What exactly did you do? Or when your problem was worse, did you ever do something that you later regretted? What is the worst thing that ever happened when you were anxious or depressed or drunk or whatever? And these questions are usually make it easier for men, because some of these are typical justifications or excuses that some of the men use for their violent behaviors, like alcohol or drug use, or being nervous or being stressed. And so if we put that on the table as a possible cause or related factor, it might make it easier for men to disclose and admit to violent behavior under these circumstances. And we can then explore if it really only happens in relationship with this other problem, or if it also happens when he's not nervous or not drunk or not jealous. Yeah, but these usually make it easier for the man to disclose the use of violence. So, and as we said, some of the funnel questions, the more specific ones, they already lead to an exploration of the use of violence. And it's of course important that if there are indicators for a high immediate risk of considerable harm to the partner or to the children, for example, threats to hurt or kill them or to kill themselves, of course we need to take any necessary measures or steps to protect them, and that might include reporting to the police or to the relevant authorities. And then we can explore more into detail difficult areas, difficult types of violence, physical, psychological, sexual violence. And in the roadmap, in the annex, you can find some checklists that you can use for that. We can also just ask for the last episode, or the one that he considers more serious or more typical of each type of violence. These are questions that we can ask to get an idea about the extent, the severity, and the consequences of the violence. And again, while alcohol and substance abuse can be an excuse and are not a cause of domestic violence, it is an interrelated problem, and it's important to explore and possibly refer an abusive man to substance abuse treatment if there is a possible co-occurring problem with substance abuse. And this might then reduce also the risk of using violence. I think I will pass over that. Looking at time, there are some, you can find some useful strategies during the exploration process in the conversations with the man that might help to avoid defensive reactions and help to the exploration and the assumption of responsibility on behalf of the men. Of course, if you work with both the partner, you yourself as a professional, or in your team, you will most probably get two quite different and conflicting stories about the relationship and the violence. And there it is important to not try to identify really what the truth is. Most probably the man will be in denial about his behavior to some extent or minimize it. And instead of trying to find out what the real amount of violence is or the truth about what happened, it is more interesting and really important, pragmatic, to focus on engaging the man on reflecting his behavior and seeking help in the midterm. And there are, as we said, some fears about engaging with the man, making the situation worse, increasing the risk for the survivors. And of course, we need to take some steps to protect the women or the women or children as possible victims. And we've talked about it. We always also must think about the possible consequences of not asking about the use of violence, and mainly that is that the possible use of violence will inadvertently continue, and victims will be unprotected. Okay. What we would do in the training, and we don't have time, unfortunately, now is do a role play where we try out this second step of asking about the violence through the funnel questions in the case of Richard. So we would do a role play in pairs. One would do the professional, one would take the role of Richard, according to the case study that you've seen. And we would try out asking Richard about his use of violence, using the information that we have, and trying to explore it to some extent. Okay. And then the third step is that if there is some minimal motivation, recognition, on behalf of the man, we would try to motivate him to take on responsibility, not only to say, yes, I've done this, but it is my problem, it's my responsibility, and I want to do something about it, to initiate a change process. And usually there is quite some ambivalence, at least, or even resistant about initiating such a change process, and some work is most often needed before we can refer to the man to a specialized service, to a perpetrator program. And there, rather than convincing or almost coercing the man to change, it usually is more helpful to explore and accompany him to really identify the own reasons for not using violence, and the steps they would like to take in a desired direction. And what we propose in the training and in the roadmap are two models or methodologies. One is Ellen Jenkins's invitations to responsibility, and one is the interview by Miller and Rolnick that has been developed in substance abuse treatment, but is also now very much used in the work with men who use violence. So typical motivators that might initially, and it's important that we only need a motivation for the man to start the process in a specialized service, in a program. We do not need necessarily a sustained internal motivation, really. So it might be the fear of legal sanctions, or not wanting to lose the relationship or the family, or wanting to get the relationship, the family back. That might be initially extrinsic motivations, but that might be enough for him to take the step. Being a good father or not being like one's own father is usually one of the strongest motivators, and if we can help the men see the consequences of their violence in the children, that is usually, unfortunately, more effective than seeing the consequences in the female partners. But having a more fulfilling relationship is also one of the typical motivators. Many of the men are not realize that their relationship is not going well, and that they are also unhappy about certain types of the relationship. And if they can see that this is at least partly due to their use of violence, then that might help with the motivation. I don't work, there's no time really to go into details about these questions that we might ask men according to the invitations to responsibility. It mainly, again, as with the motivational interviewing, has to do with contrasting what the man's values and hopes and preferences are for his life, for his relationships, for his family, contrasting that with his use of violence and the consequences of that use of violence. And these are some of the questions that we might want to ask men. And again, in motivational interviewing, according to the different stages of change the man is in with regard to the process of doing something about his abusive behavior, we can distinguish different positions of the man and in his discourse, and the corresponding tasks that we as professionals have in trying to help him take a step to the next stage. I don't have time to go into the details of this, but mainly it has to do with again creating this discrepancy, this contrast between what he wants and believes, and what he's doing, and what he's achieving with the use of violence. Okay, and then again we would do a role play in the training, usually with the same pairs, and continue the role play, probably switching the roles, where the professional who takes the role of the professional will have to try to motivate Richard to ask for help in a specialized service in a perpetrator program. And we'll try out these different questions, and it's usually very interesting to see to get the feedback from the people who play the role of the man, and see what kind of questions really help open up and what kind of questions create a defensive reaction. This works even in the role plays, and it's quite interesting to get the feedback from participants on this. And unfortunately, we don't have time to look at this. And then the fourth and last step is referring the man, which is usually rather straightforward if we have a service at hand. As Osvaldo mentioned before, unfortunately, in many countries, there's no coverage of these kind of programs. So usually they offer individual intake and assessment phase, and then group interventions, sometimes also individual interventions, and a follow-up phase where it is checked whether the objectives of the program are achieved and maintained, stopping the violence and improving the relationship if it goes on. It's important that these programs fulfill different quality standards. We've mentioned that before with regard to the European network, and that there is a contact with the partners or ex-partners and a parallel service provision to the partners. And it is important really to inform the man realistically about why he's being referred, what the benefits are, what his rights and obligations are, and to some extent with regard to the service that we suggest him to go to. And for that is important, of course, to be in touch, if possible, with these programs. Probably it's helpful to make a call before we do a referral, to ask about the requirements, maybe establish a protocol for referral, and also agree about a mechanism of feedback once the man goes there, and the coordination between the two services, especially if you're still will be working with the man while he's on the program, and see how you can support his process, his participation. And again, it is not recommended to refer men to anger management or to couples counseling or therapy or family therapy, because they are usually not safe for these kinds of situations. And again, and in the roadmap, we have a little a table where you can try to find and fill in the information of perpetrator programs in your area to know what the referral pathways and protocols are and who the contact person is. And I think we need to come to an end, Osvaldo, is that right? And would like to give people an opportunity to ask some questions or make some comments before we finish. Again, the resources, so both the roadmap and the training PowerPoint are available on the project website under the workwithperpetrators.eu project/engage in English, in French, in Italian, in Spanish, and in Catalan.
Excellent. Thank you so much, Heinrich, for this great workshop. Very, very profound, comprehensive, and also very generous from your side and your organization to share these tools with all of us.
Of course.
That's fantastic. And I'm sure we can reach out to you or your organization for further support or question, I guess.
Of course. Here, thank you very much, Osvaldo. Of course, you have my email address here. Please don't hesitate to get in touch for any further questions or requests that you might have. And we've run a bit out of time. I would have liked to do one of the further role plays with you, but you can try it out with your colleagues at home, possibly if you want to use the case study of Richard, or you make up your own case study that would work according to your circumstances. And it is a question really of practice. That is what our experience has been in the trainings, that once people start to ask these questions, they dare to do it and see it works, then they get skilled in it and lose the fears around it. But are there any questions or comments before we stop? Do we have time, Osvaldo? 5 minutes or?
Yeah, I think we can stop for 2-3 more minutes just to wrap up, especially if people have questions or requests to Heinrich. There is a thank you by Johnny.
Yeah.
Very helpful. Thank you. I appreciate the opportunity to go in depth on what this initiative looks like in practice.
Yeah.
If
Thank
not,
you.
we also want to thank the participants for staying with us, and we'll make sure that you get this the presentation offered by Heinrich. And also thank you again, Heinrich, and encourage you all to continue participating in the Global Symposium sessions. Every Tuesday we have the plenary on Tuesday, and then on Wednesday and Thursday also we have parallel sessions, regional ones, and these by themes. We get something from Astalo. Thank you so much to all. Very interesting workshop.
Greetings.
Great.
Greetings. Great. So thank you, Osvaldo, for hosting this. Thank you to everybody for your participation. It's been a pleasure to share ideas and thoughts. And please don't hesitate to get in touch if you have any further questions or requests. Thank you. Bye. Take care. Goodbye.
See you next week.
Yeah.
Thank you.
Bye-bye.
Goodbye.